My name's Professor Michael Kimlin. I'm Director of the National Health and Medical Research Council Centre for Research Excellence in Sun and Health, and I work here at Queensland University of Technology as a Principal Research Fellow. Cumulative exposure is important because it is what an individual receives over the course of a lifetime. And we think that cumulative exposure is quite important for risk of skin cancer, because those people who develop skin cancer tend to indicate that they have a lot of cumulative, or what we call lifetime sun exposure. And so that is a definite risk factor for people with risk of skin cancer. So we need to make sure that control measures are put in place to actually control exposures to this carcinogen or this cancer-causing agent. And so things like hats and sunscreens and shade are the most appropriate things that we can do to reduce those exposures. But it's little things we can do every day that are very important. So sunscreen every day is great. Look, I think we're all aware that when it's time to go to the beach, we pack a bottle of sunscreen along with our swimmers and towels. But really, the exposures that we receive are in our normal day-to-day lives. And you know, you think about what we do on a daily basis. Sometimes sunscreen doesn't really play a part. We don't think about these small, short, sharp exposures because at the end of the day, we don't come home sunburnt, do we? So the idea is to control these incidental exposures is to put a protective measure in place at the beginning of the day. So a really good idea that people can use on a practical level is for girls perhaps to look at makeup with inbuilt sunscreen with a SPF rating of 15 or even 30 plus if possible, and guys to look at applying sunscreen or even moisturiser with sunscreen for men that's actually got that protection measure in there, because then you can go about your day, you've brushed your teeth, you've brushed your hair in the morning, you put on your skin protection, and then you can get on and not really worry about these incidental exposures that occur during your day-to-day life.